just not enough beds. I mean, it was chaos.
Families desperate to get children the mental health services they need. That need spilling over into our schools.
We've seen public school systems become de facto mental health agencies.
The pandemic intensifying the problem.
I was super isolated whenever I was home.
We are having children flocking to our emergency departments.
Community stakeholders call it a crisis.
If their kids were bleeding, nobody would actually think twice about recognizing the urgency and the crisis that we're experiencing.
How do we fix this and protect our kids?
Putting a Band-Aid on a bigger issue isn't going to make it go away.
Boston 25 gets real about kids and mental health.
Thanks for joining us. I'm Carrie Kavanaugh. For the next 30 minutes, we're going to focus on kids and mental health. We found there's a twofold crisis here. A growing number of children are suffering, and there's just not enough help for them right now. Now, children were certainly suffering with mental health before the pandemic. According to the Centers for Disease Control and Prevention, in 2019, suicide was the second leading cause of death among children and adolescents ages 13 to 19. It was the leading cause of death among 13-year-olds. And research shows that up to 90% of people who died by suicide suffered from a mental illness. And throughout the pandemic, providers have struggled to keep up with the demand for kids' mental health services. As a result, many children end up in emergency rooms in crisis. And they're stuck there for days, if not weeks, waiting for help.
I mean, it was chaos. Like, his world was like just upended with services.
The pandemic, the shutdown, and remote learning sent 13-year-old Aiden into a tailspin. His mom, Rebecca Losi, says Aiden has autism, developmental delays, and struggles with social cues. At the beginning of the pandemic, cut off from school, therapy, and routine, the Whitman 8th grader was getting really sad and increasingly aggressive. And Rebecca was trying everything she knew to help him.
Anything that you can think of that would help children with autism or Aiden in general, it just wasn't enough.
What was that day like when you made the decision that he wasn't going to be safe at home and he had to go to the hospital?
That decision was one of the hardest I've had to do. Kind of broke me a bit, and also his sister.
Broken. They went off to the emergency room in Brockton, desperate for help.
So he boarded in the emergency room for 39 days.
February 10th to March 19th in a busy ER, where Rebecca says Aiden was treated well, but he was stuck waiting for a psychiatric placement.
There's just not enough beds. There's not enough services once someone reaches that level of care that they need. Especially for like children, there's less beds.
And his special needs required a specialized unit, Rebecca says, and there are even fewer of those.
He's really upset, sad, missing home, wanting to know like what's going on, like where am I going, when am I leaving here? No one had answers.
It's a difficult process, and if you're getting to a point where you need to bring your child to the emergency room, you are really looking for assistance.
Caitlin Leary is a regional supervisor for Youth Villages that offers intensive in-home services to families stuck in the ER, or boarding, as it's called. They did not work with the Losi family, but theirs is a familiar story to the Woburn-based organization.
Because the youth are becoming stuck in the emergency rooms, this allows us to actually go in and meet them where they're at, not waiting for months.
Youth Villages is trying to fill the gap in the time families are waiting for services by establishing them right in the home, right away. Typically, the team will help a family develop a plan to stabilize and find treatment. It's a short-term solution to get kids out of crisis, out of the ER, as the search for services continues.
And just an overwhelming sense of like black cloud over them.
Jackie Cotillo, the assistant clinical director of Youth Villages, says there's simply a lack of child-focused providers, magnified during the pandemic as children faced new struggles.
And with an increase in isolation, you're also seeing an increase in depression, an increase in anxiety, an increase in just overwhelmingly loneliness.
Like Rebecca Losi's son, so many end up in the ER when all else fails. After nearly 5 weeks, an appropriate placement was found for Aiden, but the wait for so many others continues right now.
What would you say to the people in charge that can make a difference here systemically?
There's no excuse for it. There's no excuse for any of this. These are children. It shouldn't have been that much of a fight to get someone help.
And we have some numbers to give some more context here. According to the Massachusetts Department of Mental Health, in March 2019, the state saw 66 total boarders reporting to DMH at 96 hours or more, including 41 pediatric patients. Now, 2 years later, March 2021, there were 687 total boarders reported after boarding for 60 hours or more, including 332 pediatric patients. Though there were some changes in data collection during this time, you can see the increase is stark. Now, not all children sought help in emergency rooms, but parents we met tell us they all saw some changes in their kids. We recently visited 3 local families to talk about the long 18 months of remote and hybrid learning.
I felt like I was just closed in and I just couldn't get out. It was like way more stressful.
That's how Isaiah Johnson describes remote learning. The Danvers student has ADHD and struggled learning through a computer.
I was super isolated whenever I was home, and then like it just wasn't fun for me.
I can tell that he's depressed, he feels lonely. Now that we're deeper into the pandemic, I feel that he would rather stay home because that's what he's been used to doing.
Mom Tiffany Patient says it's their biggest obstacle to overcome.
I think the toughest part was being a working mom and having my children having to be self-sufficient in many ways.
To Clinton, mother of 3, Erin Jameson has 2 high schoolers and a 4th grader. She says though they were fairly independent through remote and hybrid schooling, it wasn't always easy.
It was challenging for me, keeping up with like homework and classwork and not getting distracted in my room.
It was like glitchy on the computer. It was just like I couldn't understand my teachers.
Just like staying on task. And it's just really easy to procrastinate.
I think it's on this side, sweetheart.
In Peabody,
Abby needed more help with the technical side of how to get the laptop and stuff running, but she was good with the classes. And my son Max needed more help with the learning.
Every time there was a break, I would just play Minecraft.
From the battle to focus to the battle with technology.
And that's when the breakdowns would happen around here.
Melissa and Mike Troisi said their young children each had their own struggles.
It was hard because we didn't get to see our friends and our teachers in the real life classrooms.
And all of these parents and kids were eager to be back in real classrooms.
I miss just the normalcy.
And hopeful a sense of normal will help get everyone back on track.
We got to get them out of that funk.
Educators told us they know not every student will simply be able to bounce back.
We are seeing signs of isolation, fear, and loneliness. So we need to be at the ready.
We get an inside look at special training for educators in identifying a child who's struggling before there's a crisis. Plus,
we have the tools, we have the knowledge, and we have the ability to really change the narrative here.
I assembled a panel of experts to talk about how Massachusetts can better protect our children. When Boston 25 Gets Real about kids and mental health returns.
As children and their families struggle to find services to meet mental health needs, those needs spill over into our schools. I recently got an inside look at how districts are training educators to spot concerns before they become a crisis.
The people who are assigned 1
Inside this classroom in Medford,
so you're going to do 77.
the principals are the students.
Are we all set?
The subject, social emotional learning.
Social emotional learning is teaching students how to identify their feelings, relate to others, and make good decisions.
And it's not new, says Stacy Schulman, the Director of School Counseling and Behavioral Health for Medford Public Schools. What is new? The need to help students identify their struggles is at an all-time high, especially after nearly 2 years of remote learning.
You really don't know what to anticipate from all the kids walking back in these doors for the first time in 18 months.
We are seeing signs of isolation, fear, and loneliness. So we need to be able to be at the ready and support them for coming into our schools.
And that's what these Medford administrators were training for when we visited them in late August.
In your mind, try to capture a really good, accurate feeling for how you are right now.
We found a similar training for new teachers and educators in Arlington.
When it comes to mental health, teachers are a lot less comfortable in determining, ooh, is that anxiety where you're just anxious about something and you need reassurance? Or is that anxiety where you might not be safe
Sarah Fernandez-Bird is the Director of Counseling and Social Emotional Learning for Arlington Public Schools. She says prevention and early intervention are the core of a program they've dubbed Youth Mental Health First Aid.
If we don't teach students the skills to really live in these moments of discomfort and turmoil, then they're going to continue to let them snowball, and then you end up developing these anxious feelings that become so overwhelming and really crippling.
It's my first time in the building in 18 months. Yeah, it's going to be a whole new thing.
We found these discussions are resonating with educators.
I can't teach my content until, their social emotional lives are taken care of first.
And when we talk about this training, we really should consider the range of things children have endured during the pandemic, from remote learning to disrupted routines, families' financial struggles, food insecurity, perhaps even sickness and death.
On top of that, kids and families are forced to wait longer and longer for mental health services outside of school. One day in late August, Franciscan Children's Hospital told me its wait list for outpatient services had 146 kids on it. In late July, the Massachusetts Health and Hospitals Association reported more than 500 behavioral health patients, including 74 kids, were in Massachusetts hospital emergency rooms waiting for an available psychiatric bed.
Was this a wave that was building before the pandemic?
Absolutely. So in the past 5 years, we've seen public school systems become de facto mental health agencies. We're employing more licensed clinicians than ever, more school psychologists.
The goal, keep kids out of crisis.
So we're here to say we care about you, we want to know about you, we want to learn what you've been doing for the last 18 months when we haven't had eyes on you.
This school year, Medford was selected one of 15 districts in the country to be part of a new program, the National Learning Collaborative for Safe and Supportive Schools. The 2-year pilot will develop best practices for mental health in a school setting.
Are we failing our kids?
We absolutely are collectively failing our kids. We know that there's a crisis.
How can Massachusetts tackle this crisis in youth mental health? Our experts weigh in. Plus,
I think in the year of the continuing COVID pandemic, it's going to be really important that we're mentally preparing our kids.
A doctor's checklist for mentally preparing kids to be successful this school year. When Boston 25 Gets Real about kids and mental health continues.
So we have clearly established that there is a problem here. Hospitals, providers, they are overwhelmed. Families struggling to identify services, all the while these children are suffering. We want to shift our conversation, though, away from the issue to solutions. And to do that, I've brought together a fabulous expert panel. I want to introduce them to you now. Dr. Fatima Watt, Director of Behavioral Health Services at Franciscan Children's. Amara Azubike, Director of Behavioral Health Policy and Advocacy at Children's Hospital. John Crocker, Director of School Mental Health and Behavioral Services at Methuen Public Schools. And State Representative Marjorie Decker of Middlesex 25th, Chair of the Joint Committee on Public Health. We've done a series of stories in this vein, and a lot of people are giving us feedback saying, this isn't new. We've been struggling with this for years. What's new now?
I think the severity of the problems, the number of kids who are being impacted, and the intensity of the mental health problems has certainly increased throughout the pandemic.
John, you said you have data that shows that.
Absolutely. We have been engaged in universal mental health screening for years in Methuen, so we knew what this problem looked like pre-pandemic. The reality is that we're looking at 2 to 3 times greater prevalence rates for anxiety, depression, post-traumatic stress.
Amara, can you talk about the need you're seeing at Children's?
We are having children and their families in psychiatric crisis flocking to our emergency departments, but that number has almost doubled in terms of how many children on average are boarding in our EDs or on our medical floors per day. And they've needed to wait in these crowded environments that aren't meant for psychiatric intervention for almost on average 20 days.
So what you're hearing from people here is that we're just seeing more of what was already a crisis. So our schools were under-resourced and underprepared prior to the pandemic, and that has only been exponentially true when we have taken for granted that so many of our young people were served with the kind of invisible hand of upstream services that school provided.
How is a school district able to step up and address some of these needs?
In Methuen, we've adopted a comprehensive staffing model and have established a comprehensive school mental health system. What that means is that every single kid receives some degree of services. Now, not every student needs therapy, but every kid needs help navigating their social environment.
What do you think hospitals across the board need to be more effective in this area?
We are opening up an additional inpatient unit in Waltham with 12 beds. The hospital has invested in advocacy, so we are part of the Children's Mental Health Campaign. We have worked with wonderful legislators like Chairwoman Decker on legislation that will look at school-based behavioral health, legislation that will bring transparency to this issue. How many children across our state are boarding? For what levels of care? Where do they need to go?
And what we are trying to do through this legislation is to really create an infrastructure for both mental health and behavioral health, where we would create an advisory council which would really bring a lot of people from schools, from social workers to school nurses to various hospitals, to one place where we would be responsible for looking at and assessing how are we doing? How are the kids doing? And we're really going to recognize the urgency of the moment that we're in, which has only continued to grow.
Based on the way things are right now, are we failing our kids?
We absolutely are collectively failing our kids. We know that there's a crisis, and so many parents are left to think that this is their problem to solve.
We need more workforce. Over the last 18 months, I mean, our wait lists have boomed, our acuity has really risen. We need prevention before we get to this level of acuity.
The state has recognized that this is an issue. There's $31 million earmarked for inpatient acute care. I think 42 beds opened up in September just for kids. Another 40 will be brought online this year. Is that going far enough?
Right now, we are very sensitive to diagnosis and crisis, but what we need to do is to invest in prevention.
But if their kids were bleeding, nobody would actually think twice about recognizing the urgency and the crisis that we're experiencing.
This conversation will definitely continue, but I want to thank you all for your time.
Still to come, a parent checklist to understanding your child's mental health needs now that they're back in school.
If they weren't making friends, they're having big changes in eating or sleeping, if they're withdrawing.
We're bringing back Dr. Fatima Watt, who'll walk us through some important conversations you can have with your kids right now.
So students and teachers are back full-time in Massachusetts classrooms, and everyone is making the transition in their own way. Dr. Watt, a child psychologist, shares a checklist to make sure kids are set up for success this school year.
Wow, my God.
Even with the thrill of a new backpack and supplies, 9-year-old Brookline student Jordan Adamson has some mixed emotions about his full-time return to the classroom.
So I'm kind of worried, I have to wear a mask again. We're gonna be remote, so but I'm excited to see my friends.
Jordan's not the only one feeling a little anxious. Just ask Daryl Holden of Jamaica Plain.
Kinda excited and scared because there's gonna be lots of new faces.
From new faces to faces that kids haven't seen in a while, to changes in schedule and learning without a screen in front of them. Kids want to be back in school, and many parents, doctors, and educators believe in the classroom is where kids need to be. But this year, the transition is just different.
Back to school 2021 is different because it's not what we expected it would be. I think there was so much hope riding on this school year that we were going to be back, people were going to be vaccinated, masks were going to be gone, and it was going to be regular. And so I think the shock of it's not regular.
Dr. Fatima Watt is the director of behavioral health services at Franciscan Children's Hospital. She says the back-to-school grief and worry is real.
And I think in the year of the continuing COVID pandemic, it's going to be really important that we're mentally preparing our kids.
Dr. Watt says that starts with conversations.
So I've started having conversations with my kids, and they're young, so we pulled out a calendar. We drew on the calendar how many days there are till school, and we've been talking a lot about feelings and what we think about school and how we feel about school. We've been having conversations about coronavirus, and it's still here, and what does that mean?
And with COVID protocols still in place, share the rules kids should expect. Watts suggests role-playing scenarios like how to ask for a mask break and social distancing.
Is there anything that we shouldn't be sharing with our kids at this time?
I think it's important that parents are sharing how they're coping and how they're doing to a degree. I think it's really important that we're not scaring our children by saying, oh my goodness, mommy is so stressed out and we have no idea how we're going to make it through this.
Watts says don't cause panic. Emotions are contagious. Share coping strategies instead. And instill a sense of confidence by giving useful information to help them feel prepared.
So not just comfortable, but with a sense of confidence.
Right. I can do this, I can learn, I can make friends, I can be successful.
Once in school, be on the lookout for changes in your child's behavior.
If they weren't making friends, if they're having big changes in eating or sleeping, if they're withdrawing or not participating in activities that they usually enjoy, if they're not taking opportunities to socialize with peers. Those are all things that would concern me as a clinician.
Especially, Watts says, if they're not settling in after the first month back.
Dr. Watts says parents should focus on what they can control, like what's happening in your home and your kids' back to school readiness. And if parents ever have any questions, she says they should not hesitate to reach out to the school. Our work on this important issue continues. You can always find our latest coverage on our website and on the Boston 25 News app on your Roku, Fire Stick, Smart TV, or other streaming device. Thank you so much for joining us for Boston 25 Gets Real about kids and mental health. I'm Carrie Kavanaugh. Have a great night and be well.